Hello. Hello, good afternoon, everyone. Welcome to today's webinar series on supporting children with special needs. So before we starting today webinars, let's get ready up first. So for those who joining our Zoom today, later on when coming to the Q&A sessions, you are welcome to ask any questions. You can either type it down or you can just unmute yourself and you can directly raise out your questions, voice to the speaker. Yeah, and then for those participants from our Facebook Live, welcome to you guys. For you guys, if you want to ask any questions to the speaker, you can just type your comment down at the comment section there. Ourselves, we will collect the questions and then we will direct to the speaker during the Q&A sessions. So we will wait 2 more minutes for the participants to come in. There are more to come. So in the meantime, help us to share and like our videos. For those who at Facebook Live, please help us share it out so that your families, friends can also together watch it live at the Facebook. So far for Zoom participants, can you hear me clearly?
Yes.
Yes.
Great. Waiting for participants. Give me a minute. All right, so before we start our today's sessions, there are some rules, or we say the ground rule at the Zoom. So let's look at the Zoom rule first. Hello everyone, can you hear me? Hi everyone, sorry there are some technical error at the another account, so I log in this account. So without waiting any time, let's start our Zoom today. So for today's sessions, today I'm going to explain briefly to all participants that how is the flow of today's webinar. So for the first slot, we have Dr. Lim and Dr. Cheng as well joining us today to explain more on how to identify the special learning needs children and then how to handling the child tantrum. And then we'll have a break for around 5 minutes. Then we will continue to the second part where we will invite parents and representatives from PIBACAT and the Dyslexia Association to share more about their personal experience regarding to taking care of the special needs children. So before we start today's presentations, let us welcome Dr. Lim. So Dr. Lim will take over for the first slot, which is talk about how identify and understanding about the special learning needs children. So hand over to you, Dr. Lim.
Yeah, good afternoon, everyone. Thank you, Sim, for your kind introduction. Yeah, just let me share my screen. Okay, so do you see my screen?
Yes.
Oh, good. Yeah.
Yes.
All right. Perfect.
Yes,
Perfect.
Dr. Lim.
Perfect. Lovely. Yeah. All right. I think I'll start right now. Yeah. So what I'm going to share today is basically, to identify and to tell you, who are actually the students or the kids that's requiring special learning needs. Yeah. Okay. All right. Now, how common is special learning needs? Now, it is certainly a very common question that is being asked by many of you. And certainly our Malaysia has got our own data, but I believe that is probably not so accurate one, right there. So, and I decided to get this figure from Individuals with Disability Education Act in the United States. So this is basically a table showing the children between 3 to 21 years old who were actually registered under the IDA EA, so standing for Individuals with Disabilities Education Act in 2018 and 2019. So I think it's quite conspicuous and obvious that it is actually 14.1% of the students enrolled into the schools in the United States has got problem with the special learning needs. Yeah. So it is actually quite common. So 14.1%. So it is a big percentage. So certainly, and that's why, Bodhi has taken this initiative to invite me to talk to you about this problem. Well, in our clinical practice, in the clinics, in the hospitals, what kind of referral do we normally receive? Yeah, first, of course, is about poor progress in the learning, right? Oftentimes we receive the referral saying that, a certain kid or a child, a student who does not seem to understand what has been taught. Sometimes they say, the child cannot read, cannot write, or cannot count even. Yeah, and sometimes teacher will be complaining that the child is displaying abnormal or odd behaviors. For example, not interacting in the classroom, having a lot of emotional issues and meltdowns in the classroom, or the child seems to be very active, impulsive, and do not seem to kind of pay attention when teacher is teaching. And sometimes they describe the child being very rigid and inflexible. Certainly they are not following the instructions given by the teacher. And sometimes we do receive, the very straightforward referral from the school teachers saying that, look, this child needs a special education placement. And sometimes parents brought their kids to see us because their kids have been rejected or not being accepted by the kindergartens or primary schools. Or sometimes parents are concerned because their children refuse to go to school by themselves. or sometimes parents say that, teacher has been complaining that the child is not talking in the classroom, while the child is talking quite well at home or in the society. So these are the common, reasons of referral that we normally receive in our clinic. Now, so let's go straight to the point now. Who are the children with special needs, or who are the children with special learning needs, more appropriate, yeah? Certainly the first reason would be intellectual disability. Now, it is kind of quite technical, I know, but just bear with me. It is defined as someone who has got deficit in the intellectual functioning, as well as a deficit in the adaptive functioning. Now, in terms of the intellectual functioning, it is normally measured by the IQ test. And someone who has got intellectual disability would normally perform or acquiring the score of less than 70 plus minus 5. And in terms of the deficit in adaptive functioning, so this child would normally be kind of facing problem in carrying out activities such as activities of daily living, putting on shirt, taking bath, brushing teeth, buttoning, or sometimes and oftentimes they do have problem in kind of initiating or making or maintaining the friendships, or they find it so difficult to kind of carry themselves in the society, as well as in the kind of classroom situation whereby they don't learn well as expected. So this is intellectual disabilities. So if you have a child who has got this kind of features, certainly we don't do IQ tests for most of the patients, because literally we don't need IQ tests most of the time. We can do some other tests to give us kind of impressions as your child has got problem in terms of the IQ assessment. It's not really an IQ test, but those tests are actually quite useful for us to get impressions regarding your child's abilities. So this is quite straightforward. A child with intellectual disability, and oftentimes parents told us that he just looked too childish for him or for her, and he's not functioning at the level that we suppose or we expect him to be. Yeah. So this is a very common or general impression on a child who has got intellectual disabilities. And if you look at these normal distributions of IQ, anyone who has got IQ, who has got intellectual disability would normally perform below this. Yeah, so this is certainly the genius, and this is everyone of us. We are in the average group, the middle part, and those who are in the intellectual disability would be those who are on the left of the dashed line. Now, sometimes it can be quite tricky though. So there's a group of children who do not really kind of fulfilling the criteria of intellectual disability, but those are the people whom I describe as having borderline intellectual functions. Now, this is kind of quite tricky bit. This group of children would normally have an IQ score of between 70 to 85, which is better than those who are in the intellectual disability group. And normally they're presented with a learning problem, but kind of like relatively slower pace, and which is not attributable to other causes. And the problem in learning normally, kind of becomes more apparent when the child is growing up, because what they are learning is getting more and more difficult. So this group of children normally will be identified when they are at the probably, primary 3 or even second half of the primary school learning. So strictly speaking, they are not really someone who has an overly, special needs, but they just do need special attention and measures. And this group of children, if we really support them well, they could function and they could actually cope with the school learning. So if you look at these normal distributions of the IQ, so they will be falling into this group, the one highlighted in the red, yeah? So this is borderline intellectual function. Now, sometimes you might say, look, doctor, however, my child seems to be able to talk and he's able to communicate rather well, and he is very creative and he appears bright in many aspects other than academic learning. Certainly, we do see this kind of description from the parents. It's not uncommon. So if your child is having problem in learning and seems to be very creative, functionally fine in any other aspect other than the academic learning, could your child be having a problem called specific learning disorder? It is a disorder consisting of 5 to 15% of the school-going age children. And it is described as someone who has got difficulties in learning or using the academic skills. So that's why it is called specific. So it is very particular about the academic skills. So this group of children who have inaccurate or slow and effortful word reading. So they find it reading so difficult. Although they can talk well, but when it comes to reading, it is tremendously difficult to them. Or sometimes they find it so difficult to understand what they have read, or many of them do get problem in spelling, and they do have difficulties in written expression, as well as difficulty in mastering the number sense calculations, as well as solving the mathematical reasoning. So, and oftentimes we refer this group of children as having dyslexia as a whole. And although this is quite an old term, but it is still widely used nowadays. So dyslexia, it is not uncommon. Now let's zoom into a little bit more detail about dyslexia. So this group of children, these are just an example of the features that we commonly see. So they do have problem in kind of pronouncing multi-syllabus words. For example, they will say babana instead of banana, or amino instead of animal. Yeah. Oh, so they find the learning alphabet series and number series incredibly challenging. And they have problem in the directionality. For example, they're confused between right and left, up and down, in front and back, and so on. And they find recognizing rhyming patterns very difficult. For example, cat, hat, and the rat. And they have trouble in discriminating similar letter sounds, for example, B and D and P. And this is oftentimes reflected in their handwriting as mirror images. And they also have problem in blending as well as putting together in sequence 2 or more letter sounds. Okay, so basically they have problem in pronouncing. So these are a little bit more kind of a closer view on how or what are the problems that a child with special or specific learning disorders have. Now, next, number 4 will be the autism spectrum disorder. And I'm very sure that you know this. Yeah, you hear this everywhere. You hear this in the radio, you hear this in TV, and you read about it. It's basically everywhere. So what is autism spectrum disorder? So it is a condition that is characterized by 2 main problems, which are persistent deficit in the social communication, as well as restricted repetitive patterns of behavior, interests, or activities. So in terms of the social communication deficit, many of them do not communicate with you in a two-way kind of a communication. All right. Some of them, in fact, many of them can actually demand for something. But when it comes to two-way communications, they are hugely problematic. And many of them do not have good non-verbal communicative ability. So, and one very good example will be poor eye contact. And many of them do not develop, do not maintain, and do not, in fact, understand what relationship means. Yeah, for example, they don't build friendships and there seems to be in their own world. In terms of restricted repetitive behavior, so oftentimes this group of children display stereotype of repetitive motor movement. For example, they hand flaps themselves, they shake their head without any reasons, and they look at things at a very particular angle, and so on. And they do have very kind of a strong or rigidities towards insistence of sameness, inflexible adherence to the routines. For example, they must sit in a certain place when they are eating on the dining table, or they demand the food to be of the certain specific brand, and so on. And many of them do get very highly restricted and fixed interest. Now, these interests are so intense in such a way that you don't expect it to be happening in a typically developing child. And a common example of the interest would be astronomy, dinosaurs, alphabets, numbers, cars, trucks, and so on. And if not all, most of them do have problem with the sensory stimuli. They are either hyper or hypo sensitive to the sensory. And an example would be, responding too much towards the sounds of the vacuum cleaner, towards the sounds of hair dryer, and so on. So these are the problems in a child with autism spectrum disorder. And most of them are kind of quite apparent during the early childhood, meaning to say most of us will be able to identify them. And in fact, most of the parents are kind of started to have concerns when they are still young. Now, occasionally, however, there are this group of children who seem fine during early childhood or even early primary schooling. And their difficulty seems to be more and more obvious when the social demand increases with age. And oftentimes these group of children get a descriptions from the teacher as like they don't answer accordingly. And they are oftentimes out of topic. And they seems to be preoccupied with certain topics of interest that is too overwhelming to them. So if this group of children referred to us, certainly one of the reasons that the child is behaving in this way is a high function autism, or in the autumn we call it Asperger. Yeah, so this is a high function autism. They are kind of quite okay when they are young, but the problem, especially the social bit, seems to be more obvious when the child is kind of growing, when the social demand is increasing. All right, how common is autism spectrum disorder? Now, it is hugely alarming. So this table is very self-explanatory, and it is depicting how the trend of the increments of the prevalence of autism is, throughout the 16 years, from 2000 to 2016. Now, in 2016, which is the latest available figures based on the CDC in the United States, is that every 1 in 54 children aged 8 years old in the United States has got a diagnosis of autism spectrum disorder. So this is really, really common. So that's about autism. Now, next, certainly a very common problem, consisting 5% of the children with special education needs would be having attention deficit hyperactivity disorder. Now, this is a condition defined by 2 domains, which are inattention and hyperactivity and impulsivity. I understand that this is quite a busy slide, but bear in mind it is nothing difficult. It is very easy to understand. In the domain of inattention, a child has got ADHD who have problem in paying close attention to details and oftentimes makes careless mistakes, has difficulty in sustaining attention, does not seem to listen when he or she is spoken to, and fails to finish schoolwork or chores, and often has difficulty in organizing tasks, and avoid, by all means, any task that requires sustained mental effort. And certainly for school-going age children, it means schoolworks. And oftentimes they lose the things necessary for the task, for example, the stationery. Now, it's not uncommon for the parents to tell us that, I literally have to fill or refill the pencil case every day. And oftentimes this group of children are easily distracted and they're very forgetful in the daily activities. So this is inattention. How about hyperactivity and impulsivity? They are often very fidgety and they live sick in a situation when they are not allowed to do so. So they run about or climb. They are unable to pay or engage in the leisure activities quietly. They are described as on the go all the time. And they talk excessively and they blurt out an answer before the question has been completed. And they often have the difficulty waiting for their turn, as well as they often interrupt or intrude into others' conversations. Now, if I put these two inattentions and hyperactivity and impulsivity together, probably you'll identify some of the features in you yourself. Yeah, so it's actually not uncommon, but as long as all these features is not too severe, that is causing the impairment in the functions that we don't normally say a child or you, in fact, has got a disorder. Yeah, so when we say when a child has got these features that is impairing the functions, then he or she will probably having an attention deficit hyperactivity disorder. So this is ADHD. Now, how about next? So next would be the communication disorder. Now, it consists of three main problems: language disorder, speech sound disorder, or childhood onset fluency disorder. Now, let's concentrate on the first one, which is language disorder. It is actually quite common. So how a child with language disorder manifested to us? Normally, they are described as having reduced vocabulary. So their vocabulary pool is kind of quite small. So they often find difficult to search for a good word to describe something. Or they have a difficulty in making out the sentences. Even though they can build a sentence when they are talking, oftentimes the listener will find it so difficult to understand. Now, with the parents as an exception, because parents are with them most of the time, so they find it easier relatively as compared to those who are not so close to them. So even though they can build the sentence, it is kind of quite difficult to be understood because grammatically, yeah, or morphologically, the sentence is kind of quite problematic. And they do have problems or impairments in the discourse. So they find it so difficult to explain or to describe a topic, all right? And to actually continue with a more complex conversation. So this is a child with language disorder. When they are young, normally they're presented with speech delay, right? Isolated speech delay. They acquire the language very late. You know, they don't talk until they are 2 years plus, for example. And even though they start talking, you know, their progress are so slow, and to an extent that, you know, their ability is much younger, or in kind of in par with those who are much younger in age. So this is language disorder. And the speech sound disorder would be referring to those who have difficulty in pronouncing or producing certain sounds, for example, F sound, right? SH sound, and so on. And the childhood onset fluency disorder would be referring to the stuttering. So for the last two, probably it is not so much impairing in terms of the school academic learning, but certainly it is giving some degree of trouble to the child. Yeah, particularly if it is during the oral test. So physically, now if a child has got physical problem, for example, for a child with cerebral palsy, certainly, you know, you logically or certainly you know that, you know, learning is going to be affected. Now, although we know that children with cerebral palsy, majority of them do get some degree of impairment in terms of the intellectual ability, but there are still a small amount or small number of them do retain a good amount of intellectual abilities that should, by right, allow them to study in a mainstream school. Nonetheless, the physical impairment oftentimes is the stumbling block for them to learn. Either they are rejected by the school at the first place, or even though they're enrolled into the school, a mainstream school, they find it so difficult to engage or participate in the physical activities. Or for those who are a little bit more severe, they find it writing so difficult, although many of them do get kind of quite a good functions of their hands, but writing, the dexterity of the fine motor skill is still impaired. Even though they can write, it is kind of quite slow. Yeah. And next would be someone who are born with a kind of congenital physical deformity. And if you look at this child, I just have an experience of a child who literally have a similar problem to the one that you see in the screen. So this is a condition called TAR, right? So it is a condition whereby a child is born with a problem with physical deformity, and the hands deformity or the upper limbs deformity is classical. Now, this girl was brought to us, referred to us by a medical official in the Klinik Kesihatan because she was rejected by the school. So what happened is that after doing a series of assessments, we found this girl is actually having, in fact, a high average ability in terms of the language, in terms of non-verbal abilities as well. And she could talk well, and she's so interesting and lovely. And there's basically no reason why this child should be rejected by the school. Although you do expect that she might have problem in handwriting because of the physical deformity, but to our surprise, and we're so surprised, so astonished to see that she was holding the pencil using the toes, and they start to produce kind of quite reasonably good handwriting, albeit a little bit slow. Now, I don't think she should be expelled or she should be kind of excluded from our school system. So we wrote a letter and we communicated with the school, and we were so happy that she was finally being accepted to the school, and she's happy in the school, right? So kind of, I do expect her to have some degree of learning problem in the school because of the handwriting and all those things, but I think we support, she shouldn't be having great problem. Yeah. All right. So how about sensory deficit? This will be the F category of the child who has got learning problem. So, I'm not referring to those who are having profound or severe hearing loss or those who are literally blind, because those group of children would normally be identified and picked up when they are much younger, even, as young as younger than 1 year old. But there's this group of children, in fact, to me, is a kind of quite big group of children who has kind of mild hearing impairment, or who have mild visual problem. All right. So mild hearing impairment or mild hearing loss as a consequence of impacted earwax, as a consequence of middle ear effusions, for example, can actually, giving rise to some problem in terms of learning. Now, this group of children might not be able to hear what teachers talking very well, sometimes loud, sometimes soft, or they might have a difficulty in understanding or receiving or hearing a certain frequency of the sound, and hence, it is impairing their learning. A child with myopia and astigmatism, right, is getting more and more common nowadays. It is not uncommon to see, a child on the glasses nowadays in the street. Yeah. So, but those are those who picked up, meaning, parents are aware that, their kids has got, refractive errors or has got astigmatisms. But you were surprised that there are still many out there who has got this problem but not being identified. Yeah. And the worst thing is, if they are put at the back of the class, how can you expect them to be able to read the blackboard or the whiteboard well? So these are the group of children that, if we are able to pick up and the refractive error being corrected, they shouldn't have any problem. Now, I'm very sure that you are very familiar with this picture, although these are the Caucasians, but I mean, we see this in our society, very, very common. right? So these people or these young people are so indulged and they are so addicted to the screen, to the gadgets in particular, and it is certainly detrimental to their vision, right? Now, the worst thing is if they are allowed to use those gadgets in the dark, this is even worse, right? I mean, it is not going to be helpful to their vision. So not uncommonly, as a doctor who's practicing in a hospital, we do see children with chronic, medical problem who are required to stay in the hospital for quite some time. A child with cancer, for example, who are required to stay in the hospital to receive the oncology treatment. A child who has got asthma, which is poorly controlled, that he or she is getting the exacerbations or the attack very often requiring admission. A child who has a condition called thalassemia, who's required to go to hospital for regular blood transfusion, for example. Those are certainly kind of important culprits for me that is kind of contributing towards a child who is not learning as expected. And nutritional wise, in particular, iron deficiency anemia, which is not uncommon in our society still, can cause problem in terms of the attention as well as the energy level of the child. Yeah. So if you have poor attention span, if you are always tired, and then you expect a child to not be able to learn well. And lastly, yeah, a child who has got problem derived from the brain, for example, seizures or epilepsy, particularly those who are not well controlled, right? That can certainly be causing problem to the learning. Now, we have discussed 9 categories of the children who are not learning as expected. And those 9 categories are largely derived or intrinsic or derived from the child itself or themselves. Now, how about if any extrinsic factors that is not very much to do with the child, but with the environment that the child is living at or living in? So the first would be the lack of opportunity. Now, you were surprised to see that there are still children out there who are not receiving kind of academic learning as expected. And a common one would be skipping the 2 kindergarten years. So meaning to say, the first time ever that the child receiving the formal academic learning will be in the primary 1. Can you imagine? Most of the children are receiving the learning or academic learnings for an extra 2 years, and this child has to catch up. Yeah, so it is kind of quite difficult for them. And sometimes children, especially in a very rural area, they don't have kind of the opportunity. In fact, although parents want to send them to the kindergarten, but there's literally no kindergarten for them to go. So this is the problem with the accessibility. Or sometimes even the child can get access to all kinds of tuition centers, private schools, government schools, and then etc. But they are not receiving adequate stimulation or appropriate supervision. And a very good example would be the games and gadgets. Yeah. So I'm very sure you know what's this. Now, if you don't know also, don't worry. Let me tell you, this is Minecraft. This is a very popular game. Probably a few years ago, a little bit out of favor now, but still relatively quite popular. Or a more popular one nowadays would be Roblox or Among Us. I don't know if you know about it. To be frank, I don't know all these things. And then where do I go? Where do I get these informations? From my daughters. You know what? Most, if not all, of her classmates are playing those games. And they are so indulged. When I look at the chat box, the WhatsApp, it's all talking about the Roblox and Among Us. You see the problem. It is a huge problem. Yeah. So as a parents, we should actually, provide them with the proper supervision. That indulging too much in this kind of thing is going to be detrimental to their academic learning. They'll be thinking about the Roblox. They'll be thinking about the Among Us, but not the science and the maths. And not only that, psychosocial factors, family discord, separation and divorce in a family, abuse of any kind, domestic violence, drug or alcohol abuse in the family, or even bullying in the school are potential causes that can lead to a child who is not learning as expected. So I'm very sure you know what is this. Yeah, this is a close view of our coronavirus 19. So schools are asked to open, to close, to open, to close, to open, and finally to close to many schools nowadays in Kuching as well as in other districts in the Sarawak. Now, what I would like to say here is many children, in fact all, are not receiving good quality educations for past year and for many months for this year, at least for the early phase of 2021. Now, no doubt, an online learning is an alternative, but I can assure that you are agreeable with me that it is going to be not as effective as the conventional physical face-to-face learning. Yeah, I think Dr. Ong, who is going to share later, will be agree with me, will be agreeable with me that we are seeing a lot of children nowadays brought to see us because the child is not learning as expected, and it makes us a huge headache that we can't, we basically cannot figure out if this child has got problem or this child's problem is kind of arising merely because the child has got no opportunity for the past year to learn in the classroom. Right, so it's kind of a big problem to us, and we hope that coronavirus is go away very fast, but it looks like it's not going to be too soon. Yeah. All right, so these are the causes that I think that I can think about that is contributing, or they are contributing to the problem to a child who is not learning as expected. Now let's summarize what I have said just now with this table again. So you know that there are 14.1% of the school-going children in the United States in 2018 and 19 who has got special learning needs. Now let's look into a little bit more detail. So who are those people? Autism, 1.5%. Emotional disturbances, 0.7%. Hearing impairment, 0.1%. Intellectual disability, about 1%. Multiple disabilities, 0.3%, specific learning disorder, about 5%, speech and language impairment, 2.7%, and visual impairment, 0.1%. So this is kind of quite similar to what I just told you just now. The only thing is I probably have a little bit more, which is not included here. I think with that, I thank you for your attention. Yeah, I shall pass the screen back.
Thank you.
Yeah.
Yeah, thank you so much, Dr. Lim, for your wonderful sharing. I learned a lot of these things. I just know about there's 9 categories of these special learning disabilities. Yeah, and then we got a few questions as well from the floor. So let me ask one of the participants from the Facebook, Jackie, is asking that for Dr. Lim, is dyslexia is counting as learning disability?
Well, I think first of all, we need to define what do you mean by learning disability? Yeah, to me, I would say this is a learning difficulty. Yeah, and make it clearer. Yeah, difficult learning. Yeah, so difficulties in learning. Yeah, so certainly dyslexia is one of the culprits. Yeah, as you know, that is contributing towards the problem in learning for a child. Yes, it is certainly.
I see. All right. And then Jackie also got asking about the stuttering, or what we call the hammering. What age should we pay attention to? Sometimes it started around 4 to 5 years old, but then disappear around 11 to 12 years old. So is this count as normal?
Yeah, it is not uncommon to see a little bit of stuttering, for younger age children. Yeah, but if that is physiological, I mean, it is part of the developmental process, it should disappear sometimes later, All right. So if the stuttering is kind of persisted beyond what we expect the child to kind of getting rid of it, I think it is a concern. Yeah. But as I said, stuttering normally do not cause big problem in learning. Yeah. It is kind of more of a problem when it is during the oral test. Yeah. So when the child is not talking fluently, that it could potentially be affecting the information that the child is trying to deliver. But if I were to be the teacher, knowing that this child has got stuttering, yeah, I'll probably give child a little bit longer time for the oral test, and I'll probably kind of marking the child, kind of putting aside the problem of not able to talk in a fluent way as one of the criteria for me to judge him or her. Yeah, basically this child needs some support, right? And it oftentimes depends on how much support the child and the teachers want to provide to the child. Yeah, so if you think your child has got problem with stuttering, that is beyond what you expect the child to be getting rid of it, it is okay for you to see a speech and language therapist, yeah, for them to see if they can do something to help your child.
I see. All right. And then for Zoom, Edward also got asking, do the learning disabilities such as dyslexia allow children to get OKU cards? And then what about ADHD, autism, ID also?
So certainly, in the constitutions of Malaysia, these are all the conditions that is well spelled, under the categories of OKU. Yeah, very, very, very unpleasant name. But it depends. I mean, whether or not we want to register a child as an OKU for having dyslexia, for having ADHD, and all those things. At the end of the day, is the final decisions it lies on the parents. Yeah. But practically, I would say it is not compulsory. It is not compulsory, as long as you can overcome the problem. Okay, by sending the child to see Dr. Ong, getting a very good tuitions by our president of Dyslexia Association Sarawak, and many of them actually kind of overcome the problem. And in that case, I think probably registering a child as an OKU probably is not that crucial. Yeah, but if your child is having very severe dyslexia, and particularly for those who are not just having the dyslexia plus language disorder, dyslexia for attention deficit hyperactivity disorder, then by all means, no matter how we try to help, then the child still struggles significantly in the classroom, then I'll probably say, OKU registration is something that we should think about, because potentially the child would need some special class, especially when we see the child is getting a lot of stress and getting a lot of probably in the school, being bullied and all those things. Yeah. So it is a very dynamic decision, I must say. It is not kind of 1 + 1 = 2. Yeah. And oftentimes, in the clinic setting, I also find it very difficult to decide. But at the end of the day, I think it is a discussion between the health professional and the parents to come up with a final decision.
Okay. All right. Okay. Without wasting any time, I think we should go to the second talk first by Dr. Chang first. And then for the questions, actually there are a lot of good questions from Edward as well, like developmental milestone parents should look for. But I think that we will talk more on the afterwards Q&A sessions. So for now, let's move into the second part where we invite Dr. Chang from BMC to talk about how to handling a child tantrum. So over to you, Dr. Chang.
Hi, can everyone hear me?
Yes.
You can, okay, without, anytime, let's get started. So today, I'm giving a title like how to actually manage children's tantrum instead of tantrums. behaviors. What is a lot of our patient or parents will come and complain like refuse and ignore requests or manifested socially have some aggressive behavior, banging the head or refuse to eat or biting their own hands or biting others during tantrums, so screaming, crying, rolling on the ground, and also some self-stimulating behavior like rocking, hand flicking. So these are some examples of challenging behaviors. Okay, wait. I think I have some problem with my slides. Let me stop sharing for a while. Okay. Oh yeah. Okay. Sorry. So let's continue. So why this happened? Why this happens to them? So it may be because of they have trouble understanding what's happening around them. So what other people are trying to say, or using a non-verbal communication with them, or they don't have effective ways of communication and that cause frustration. Now, so a lot of time our children respect what is their needs and what do they want, and frustrations in them, and this will be manifest or shows in their behaviors. Or also, they may be because of they are anxious about the situations, about the new teachers, about changing the environment. So these are some example of causes that cause some challenging behaviors. So I would like to introduce to you one thing is behaviors and children's emotion is actually a form of communication. I want to stress here, behaviors and emotion is actually a form of communication. Children, even us, even we as an adult, we communicate through not only through words, but also behaviors, our actions, but also our emotions. If this is the case, what does all these pictures that I showed you in the slides trying to tell you? What are these children trying to tell you? And what are you hearing? What do you get from that? Maybe you can think of your own child when they are showing some so-called challenging behaviors or difficult behavior. If we perceive it as a kind of communication, what do they actually want to communicate with you? What do they actually trying to tell you? So what we see, it may be only a tip of the iceberg. Fighting, hitting, kicking, screaming, biting, throwing, crying, shouting, aggressive behaviors. But what we don't see is actually there's a lot, like I need a break, I'm tired, you aren't understanding me, I'm overwhelming, I need to connect with you and this work, I'm not bad, I just want to communicate, I just want to release my emotion. Oh, I'm hungry. So with children with special needs, they also have a special triggers for them. For example, like what Dr. Lim have shared, those with autisms, they may have their own routines and rituals. When we disturb their routines and ritual, they might find it uneasy and they may want to show their uneasiness to you by protesting or throwing tantrums to you. Or and also with children with special needs, they need a longer time and preparations for their transitions from one activities to another, from one place to another. So this is maybe the reasons that they are trying to communicate with you, telling you that, hey, I need time, I need some preparations, or don't disturb me. And also, it may be sensory sensitivities or sensory overload. there are too many things at one time. So they felt too much and they can't hold it, they can't process it, and it's causing frustrations. It's the same, like if you can still remember when we work from home and messages, emails, calls, workload are overwhelming to you, and your kids and your boss and your partners and the dogs outside are all making the noise at the same time. How would you feel? Maybe this is how they feel too. So also we don't, our children, they are smart enough sometimes to really to sense there is some expectations from our parents. So when parents have unrealistic expectations towards our children or over expectations to our children, hoping that they are like other so-called normal children, it may be hard for them to catch up. It may be hard to them to meet your expectations. When parents, you feel that your expectation was not met, how would you feel? You will feel anxious, you will feel angry, you will feel frustrated, you will feel disappointed. And this emotion may be spread to your children, and your children can feel it. And then they will express all these emotions to their behaviors. Maybe they are tired, maybe discomfort, and of course, there's also other conditions like bullying, like feeling tired, feeling sick. So these may be the one of the causes for all the difficulty or challenge of behaviors. So today, especially in my sessions, is actually more to like how to manage them. How, as a parent with all this busy workload or taking care of children or taking care of homemakers, how are we going to manage these children's behaviors? So I would like to introduce you as adults. We also need to learn ABC. And A is actually antecedent. So what is antecedent? Antecedent is actually an event or triggers that happened right before a behavior. Okay? And behavior is a way that your child responds. And consequences is an event or activities or behaviors or rewards that happens right after that behaviors. So this is what we call A, B, C. Before we can manage a child's behavior, we need to really analyze by using this ABC. So antecedent is what is going on immediately before Rob, example, Rob is aggressive. So behaviors, what exactly is the behaviors? We need to have a clear descriptions in order to be able to monitor and understand it. You know, we couldn't say, oh, tantrums, throwing tantrums. What do you mean by tantrums? Is it biting hands? Is it pushing siblings? Is it throwing things from the tables or throwing things towards mom? So you will need to specify that behaviors and what happened before that, which is the antecedent, and what happens after that is the consequences. So first of all, we all need to clearly define the behavior. So rather than just general terms, aggressions, tantrums, we need to think about what the child or Rob, as an example, actually does and explain it in a clear, concise way. So usually with the behavior, it comes with a function. You know, your child behave in such way, they must have some function behind it. And we categorize it and we generally will see it in 4 ways, for 4 functions. First is they want to get attentions from you. Second, self-stimulations. So for example, hand flippings, tiptoeings, or rocking the body, or humming, is all is self-stimulations. And of course, we also have a very big proportions that they emitted certain behavior is because they want a tangible rewards. So example, access to activities or items. You know, example, they will throw tantrums if you take away their phone. For example, they will scream if you stop them playing phones or you stop them eating, example. So another one will be escape or avoidance. Example, for example, every time you ask your kids to finish their homework, they will start screaming, crying, arguing with you. Why? Because when they do that, you're so frustrated, you will scold them, and then you try and you become, you involve in this battle. And then you ultimately, if you get tired and you just allow it, then they can escape from completing their homeworks. So all these behaviors behind it has a function: attention, self-stimulations, tangible rewards, escapes, or avoidance. So, and beside that, we have environment. So we have to look at our environment changes. Is this environment, if I can change the environment to reduce a child's exposure to a stressful situation, if this is the air, you know, the antecedent, to reduce his exposure to loud, busy social environments, can we do that? Or alternative strategies for Rob or the child can communicate his distress and work with him to develop strategies. For example, writing a red card if he's finding a situation is too difficult to manage, or create a safe corner for the child to really express her emotions and do whatever they want in that safe corner and respond to his or her aggressive behaviors. Okay, next we move on. After we know about ABC, you know what's the antecedent, what caused it, and why this behavior happened. By looking at the consequences, are you giving them a positive or negative attention? Are you giving them a rewards so they can access to the phone? Are you it's because of self-stimulation, they feel safe, they feel soothing, or is it because of they can escape or avoid for certain tasks or activities? So after knowing this function, then we may think, how are we going to change and manage our children? Very quick. So maybe everyone's here, you may want to think, or especially for children or for parents, you may think, one, choose a behavior. Okay, everyone's here as a parent, we choose a behaviors from a child. Okay. Step 2, can you identify the triggers and reward in which the A, antecedent, and also the C, consequences? For example, so difficult behavior as tantrums, which is step 1. And then you identify the triggers, which is 4 p.m. Monday, where in the car back home, what happened before the behaviors? Stop at the shop to buy milk. What happened after? So soothing the child because the child's threw tantrum. So mom or father's trying to soothe the child and back home without buying milk. So what is the function here for the tantrum? Escapes, avoid, or having tangible rewards. So we stopped. We get what we want. The child get what he wants. Don't want to stop at the shop to buy milk, but directly go home. This is the function. And then we have step 3, which is make changes. So by knowing all this, the rewards, the triggers, then we want to make change. So we organize like a predictable routine using pictures or timetables. We prepare them for changing routine. So for example, give a 5 minutes warning. For some of our children, we're not only giving them a verbal warning, but also visual warning. So maybe we not only 5 minutes warning, but in the early morning, we already warn them. Set up a gradual introduction to the environment that might be overstimulating. For example, changing from kindergarten in a semi-D house that change to another kindergarten, which is on the second floor of your shop lots. Okay, so how to slowly, gradually introduce them to the environment that may be overstimulating them. So set a gradual introduction, or we say it's systematic exposure therapy. And then we can need to communicate clearly using language, symbols, pictures that your child understands. Not only verbal, your words, but also symbols and pictures. Teach your child how to ask for things. We can use words, we can use pictures, and calmly ignore your child protest. Later in the slides, I will share with you what we can ignore and what we couldn't ignore. So making changes, number one, we try to prevent or set your child up for success. We try to modify the situation so that your child will not have to face a meltdown. For children with special needs, actually for parents, 70% of our efforts is to prevent. Okay, 70% of our efforts is to prevent. And then other 30% is to how to really, when the behaviors is happened, how are we going to react to it? So if you want to make a change, we try to prevent first. Considering environment, we have maybe have a special plate only for that child, have a special seat for that child, compromising between your needs and your child's sensitivities. So for example, we go to the shopping centers at a quieter time. Social stories, so we're preparing them by telling story, by using sounds, by using some videos to facilitate them and to introduce them, and practice mindfulness. So practice mindfulness is how to help them to be in the present moment, help them to be more concentrates. And next, prevention also, the one very important element in this prevention is communications. Okay, in terms of communication in the family, before 6 years old, family rules, setting limits is very, very important. And some of our parents don't know or a bit confused how to set rules. So what is family rules is actually what is okay and what isn't okay. We must make it clear. And the first priority of our family rules is we want to focus on safety, the child on safety and other safeties, followed by manners, daily routines, respect each other's, and this family's rule, because it's called family rules, family. So it has to involve all family members. And this has to change when your child gets older or the family situation changes. And also communications, one very big part of communications is about instructions, how to give instructions. The precondition of giving instruction is to get child's attention. Okay, you don't get child attention, please don't give instructions. Get the child attention first. And then one instruction at a time. Make it simple, make it straightforward, make it clear, and also make it positive. For example, instead of don't run, Lily, but Lily, can you please walk beside me? So instead of don't, negative, we change or shift it to something that is more positive. So some examples of how to give instruction. So for example, at step one, we give instruction one time. So by saying this, George, wash your hands. Give 5 seconds, we wait. You know, some of our parents are with impatience. If cooperates, then we give encouragement. Encouragement here will be a reward. And if not cooperates, we move to step 2. So give instruction and demonstrate. Say, George, wash your hand and point or walk over to the sink. Give 5 seconds. If cooperates, give encouragement. If not, we move to step 3. So now we give instruction, but at the same time, we also use physical guidance. So we say, George, wash your hands, and hand over hand guidance to wash your child's hand. don't stop guiding until the instruction is complete. And then we give encouragement or praise. So this is something that we want our child to listen to instruction, to respond to instruction, and also to learn a new instruction. So these are the steps that is suggesting for you to you. So what if they don't follow rules? Simply remind them, okay? Our child are quite forgetful sometimes, even us are quite forgetful. So there's nothing wrong for us to remind them. And this reminders not only words, but also pictures, okay? Give them another chance. And also, I think a lot of our kindergarten or primary school teachers, they like to use what we call a reward chart. So they have a big chart there, and then with writing all the consequences of the breaking rules with pictures, and also what can do and what can't do. If they did it, get a stars, and how many stars if they collected, they will get a rewards. And this is a reward chart. So besides family rules, before 6 years old, we need like some negotiations. We also give opportunities for them to make decisions, and we also give them responsible. Okay, this is before 6 years old. And then after 6 years old, if they are throwing tantrums and if they are having some challenging behaviors, we sit beside them, keep quiet rather than score a hit. No, we can pat his back, rub his back, pat his shoulder or her shoulders to help him to process the emotions with him, help him to calm down first, then we discuss. Okay, for families, it's very important that there is no comparisons. Don't like when you are scolding or when you are talking to your child, oh, you see your brother is like that, why don't you like this? So please, we're trying to minimize that. And we will focus more on process instead of outcomes. So we then say, oh, good girl. Is encouraged for parents instead of like, oh, I'm a good girl. But we can say something like, I can see you are really hardworking and enjoy you finishing your art. So you are praising or encouraging the process instead of outcomes. And like just now I said, when we communicate, we use visual supports. So for those who may have some have some speech delay or problem with speech, then we can use all these cards to exchange, to communicate, or even make a to-do list at home to just paste it on the wall to let me, so also as a reminder for our kids. Second, so that now is prevention before the behaviors. Now during the behaviors, and I said at some point we need to ignore. If a certain behavior with a positive consequences, then we want that behavior to increase. For example, they can continue to be disciplined, they can continue to take out their homework and do it themselves, they can help you to clean their plates, they can help you to put their shoes at the rack, they can go to when you ask them to go shower, they can immediately go to shower, okay? Positive consequences, then the behaviors will increase. And also, with neutral consequences, the behavior will decrease. So for example, if he or she is doing it for you or for their aunts, we don't give any attention, we ignore it for the good behaviors, then slowly, gradually, that behaviors will diminish, will decrease. So it's very important what attentions or what consequences are we giving to our children. So what can we ignore? Okay, how we ignore? Number one, eyes, your eyes, look away from the child's eyes and do not make eye contact. Body, maybe your body turn away from the child's body. Timing, ignore immediately as soon as the child displays such behaviors. Emotions, keep a neutral expressions on your face. Do not show how angry, annoyed, irritated you are, take a couple of deep breaths. Do not get drawn into the arguing, scolding, and even talking. So this is the tips for how are you going to ignore. And then we have something that what should we ignore? If your child keep complaining, talking back, making noises, more arguing, asking the same question again and again, over and over again, repeating things and do things to get your attentions. And what we don't ignore? Hitting, slapping, throwing, mean to animals, or disobey instructions, threatening, forgetting to do chores, being afraid or shy. Okay, these then we don't ignore. Okay, we need to have to talk, to process about it. And also during the behaviors, we need to shift from negative attentions to positive attentions. So what he or she has done well, and you are quite delightful, pleased with their behaviors, please don't be stingy with your praise and encouragements. Okay, and if during the behavior there's some kind of emotions going on, we help them to process. We just sit beside him, patting him, introduce him, or if invite him or her to talk if he or her wants to. If he doesn't want, then allow the space for him or her. And then when you see the moment that stops or they're calmer, quickly go in, step in and introduce, like, oh, do you want to talk to me? I see that I see that you are calmer now. You want to have a talk. If can't talk, okay, then maybe use your body to really soothe them, help them to process. Okay, so we have talked about before the behaviors for prevention, shifting your attention, during your behavior, help to process and what to ignore, and after the behaviors. So after the behavior, it's very important that we go and validate their emotions. So you can say something like, oh, mommy, see that you are quite angry just now. No, validate the emotions. I see that you really, really frustrated towards your brother. Validates the emotion. And if you ignore him or her, or even, sometimes we are a bit lost control, we may say something, or we may say some words, okay? So after the behavior, we may want to rebuild the connections, rebuild the relationship with your child, sitting together, not only using words, but using your body. Sit beside it is a way of rebuild relationships. And then we encourage your child to find solution together with you. So we don't give solution, we don't give suggestion immediately, but we invite them, we ask them, and show interest to listen to them. If they really can't because they are too young to do that, we always can give them a list, we can listen to them, and we can suggest to them and ask them to do together with you. So this is the after behavior. We're finding solutions together and process together. So as a summary, so we do ABC first, antecedents, behaviors, and consequences. Choosing your behavior, trying to figure out what is the trigger, antecedents, and what are the consequences. So functions, so is it because of attentions, tangible rewards, escaping and avoiding, or only self-stimulating? And then after you have analyzed and understand your child's behavior, we move on to management. So step 1, you choose a behavior. Steps 2, you identify triggers and rewards, and then you manage. So before behaviors, you prevent it. You know already because you have identified the triggers. It's because of environment, you're trying to prevent through your rules, through instruction, to your visual supports. And then during the behaviors, you're trying to ignore, you're trying to shift your attentions, you help to process. And after the behaviors, you're trying to rebuild, you're trying to validate, and you find solutions together. And then that's all from me. And thank you very much for your attention on how to manage our child's tantrums or challenging behavior. I will pass it back to Sim.
Thank you, Dr. Chang. Very insightful sharing. Wow. This is like what we say, the toolkits. I can see a very detailed step by step how we should do as a parents if we are going to handling the child tantrum. Yeah, I totally agree with Dr. Chang's point that first, we also need to identify the causes or why the child is going to having tantrum. This is a very important point. Some parents, they are try to skip that part. They jump into like, what should I do? And then what should I stop? Yeah, but then we all sometimes overlook about why child are doing this thing. This is a very good point that Dr. Chen mentioned today. All right, so let's see, is there any questions from the floor? Yeah, I don't think that at the moment we have any questions. Yes, Xu Jing also comment, very detailed explanations. Thank you, Dr. Chang. So, all right, so for the moment, participants can still continue write any questions that you would like to ask to Dr. Chang. But then we were coming back to the big Q&A sessions and asking direct the questions that you guys asked to Dr. Chang. So for now, we are going to the second slot where we are going to invite Dr. Ling as a moderator, and then as well as Madam Kui Chu from Pibakat and Dr. Ong from Dyslexia Associations to talk about sharing about their parental experience. So let me hand over to Dr. Ling. Hi, Doctor.
Hello.
Hi.
Hi, everybody. Okay. Actually, we were thinking of having a break before we go into the second part, but I think, you know, we are a little bit behind time. So how is everybody? Do you feel that you can go straight to the second part? Yes? Okay, everybody okay? Okay, good. So, well, welcome, or welcome back, everybody, and also welcome our two speakers who I think joined us a bit later just now, but you know, it's good that they are here. And so this second part on our webinar, Supporting Children with Special Needs, we have invited, and we are indeed very honored, to have invited Dr. Ong Pui Hong and Miss Ng Kui Chu, who will share with us their experience, of their journey of being parents of children with special needs, but also their experience of, being in their own organization. For Kui Chu is the Pibakat Association, and for Dr. Ong is the Dyslexia Association Sarawak. And I think just now, Dr. Lim and Dr. Chang gave very good information on different types of learning, disabilities or difficulties. And Dr. Chang also gave us a lot of tips, ABC and 3 steps about how to handle children with behavioral issues. But for both Kui Chu and Dr. Ong, I know your children are in your adult years already. So, you have come such a long way. So I think, our audience will be very interested to hear from you both, your personal experience, maybe starting from the beginning when you first know that your child has some kind of special learning needs to, now. So can I, pass the floor to Kui Chu first and then Dr. Ong.
Okay. Is the mic working well?
Yes.
Can you hear me? Okay, yes, thank you. Thank you very much, Dr. Ling. I have been told to truncate certain parts in view of time constraints, so I will make my sharing very short. and just like a mini skirt, enough to cover what is essential.
No, it's okay. I
Short
think
enough to attract attention. Right?
yes.
Now, everybody, what I'm going to share is about something that happened 23 years ago, and things have changed a lot by now. May 19, 1998 was a special day for us. The day my youngest daughter, Tan Yi Ping, we call her Ping Ping, was born. And doctors, the same evening, we found out that she has Down syndrome. Me being Kiasu, I think a lot of us are. That's why we're all here. I could not accept that. And of course, I said, doctors are wrong. She cannot be having Down syndrome. Nobody I knew had Down syndrome. Nobody I knew had any family member who had Down syndrome. So, and cut long story short, I live in denial for at least a year. I could not talk about her condition for at least a year without breaking down. Deep inside, although I live in denial, I knew some of us here joining this program are parents, so you will understand what it was like. You know, but you don't want to know. So anyway, it wasn't easy, not because Ping Ping has Down syndrome, but because children with Down syndrome tend to have a lower immune system. And Ping Ping was no exception. 23 years ago, like I mentioned, things were not the same then. Being Kiasu mother, I totally breastfed her for 4 months. Then after the first 4 months, Ping fell sick often and was very susceptible to upper respiratory tract infections. Due to, and doctors will know, due to prolonged infections, she developed this condition. And this condition I find is quite prevalent among children with Down syndrome, condition called enlarged adenoids. Adenoids are like what you call that, infected nodes along the nose instead of in the throat. And she frequently had to be hospitalized. It was very embarrassing for me because then I had to take leave, and everybody in campus would know, okay, Ping Ping has been hospitalized, sit in for Quichu's classes. So, and that was not the issue. The issue was because of too many adenoids in her nose. Every time she cried, she turned cyanosed. That means she lacked oxygen. So I remember 23 years ago, sitting in my armchair all night long to cradle her so that she could breathe properly and sleep better. For 1 night, 2 nights is okay. 1 week, 2 weeks, but after some time, you can get very tired because I still had to drive all the way to Samarahan. In those days, I used Morathuang Way. 23 years ago, the highway wasn't ready yet. So anyway, I'll cut it short. Ping Ping also had a second challenge. She had very weak muscle tone, very typical for children with Down syndrome. She only took her first step and could walk 1 step when she was 4 years old. Third challenge. In those days, there was only 1 speech therapist serving the whole of Sarawak. Now we have more. And I am not sharing with you a success story. I'm sharing what I should have done 23 years ago to have further improved the quality of life for Ping Ping. So in those days, only 1 speech therapist. When she canceled the session, I also canceled. So I didn't put a lot of effort into that. If I had put in more effort, Ping Ping would have been better off in terms of speech. What she is capable of now, being able to identify words, I owe it to, thank you very much, Dr. Ong, who was very patient, more patient with her than I am as a mother. Okay. So anyway, Ping Ping has very limited vocabulary, but she can still communicate what she wants to say, which goes to show that we don't have to be eloquent speakers to be able to communicate the message. What is important is Ping Ping is very compassionate, very gentle, very compassionate. So another challenge, she is very slow in carrying out activities of daily living, daily activities like eating, changing, brushing her teeth. And I used to joke, but after some time you give up joking, that Ping Ping teaches us about mindfulness and appreciating life by slowing down. Ironically, I am always on 5th gear, while Ping Ping is always on 1st gear. And then she is also one child who sticks to routine. 23 years already, I should be saying child. Then we didn't see it coming. Parents, sometimes we don't see things coming. Upon reflection, realize I should have done this and that. So it is a bit difficult to make her adapt now. To try to understand the concept of urgency, to try to understand that she shouldn't stick to routine. Anyway, I had even last night, I had a bit row with her because she took a long time brushing her teeth. So why am I telling you all this? For those of us who are parents here, I have traversed the road you are taking now. I know what it's like trying to grapple with the fact that your child has special needs, special learning needs, special physical needs. They are still special needs, and getting them registered in school is also very challenging. I have had my share of tears, frustration, guilt, and helplessness. There were very little resources I could turn to 23 years ago. I felt lost, and nobody could help much. Okay, but we did have one early intervention center run by P. Bakat. That is why I felt that P. Bakat was one of my greatest pillars of support when I was drifting around looking for help. Anyway, I am lucky to have a very supportive family. When you have a child with special needs, it is very important that the family comes together, like what our two doctors emphasized on earlier, that it's not one person's work. The whole family must work together to make sure that the child learns, whether it's behavior modification or learning. So anyway, we feel that Ping Ping has come into our life to change a lot of things. Most of all, she has taught me I'm very impatient about patience and compassion, about appreciating small blessings in life that we all take for granted. And then we feel that we are still very thankful for her. So anyway, I want to share this with parents. Suddenly, I'm having a throat issue. Take one day at a time and take that day positively. For parents who have children with very challenging behavior, I know it is very frustrating. You don't have control over the future, but you have control over today. And what our two doctors have shared will help to a great extent in ensuring that we can control our children. Another thing, remember, you are not alone. We are very lucky. Right now, we are very lucky. I'll share with you why later on. The state is also coming in to help parents like us. Okay, and there are lots of parents and professionals like our two doctors who can tell us what to do. During my time, what was given to me was a lot of inaccurate information. Okay, information like if your child has Down syndrome, she will be able to help around the house. She may even be able to count up to 5. 23 years ago, one pediatrician told me that. There's a lot of difference now, and doctors know better. So anyway, we may have special children, and sometimes their behaviors are challenging, but we also have to consider the feelings and needs of our spouses and our other children. When Ping Ping joined us, I had 3 elder children. Sad to say, I think I had no time for them. All my time was taken up with Ping Ping or my work, which could not be neglected. We still had to put food on the table. So it was difficult to strike a balance. Work, Ping Ping, and the other children. I was very lucky, still am lucky. My eldest child is very responsible. She have a lot, very good leadership skills. And I think they grew up overnight. after Ping was born. Okay, so anyway, another tip I would like to share is be kind to yourself. It can be frustrating at times when little trigger off some challenging behavior in your child in places like public places. When you just want to go to the restaurant to have a nice decent meal, your child acts up, there's a meltdown. What do? Be kind to yourself. Don't focus continually on what needs to be done. I was that kind of kiasu mother, always planning what to do next. Just sometimes take a step back, look at what you have accomplished. And I think it's also important to take a break, stop and smell the roses. Okay. I don't want to go on more. I want to share a bit about P-Bakat and another new center that has just come out called OZAG. 23 years ago, the outlook for children was quite pessimistic, but now things have changed. Okay, so the initiative by our state government, especially by Kementerian Kebajikan, Wanita dan Kanak-kanak, the setting up of OZAG is a step in the right direction. Yeah? And apart from P-Bakat and OZAG and the various PDKs, of course, we have this Dyslexia Association, which has made a lot of difference to children who have special learning needs and who cannot read. Okay, so another thing I want to share with parents, inclusion is the key to break down barriers. Try if possible. I hope to see full inclusion for our children, but we are still a long way off to see them accepted in mainstream schools, because we have a lot to learn from Cebu. Try to enroll. Cebu, what Cebu is doing now is a lot of children are being included in mainstream preschool. Start them young, start at preschool. Okay, so I think Cebu is a classic example of how beautifully inclusion can work among preschools. Start them young so that when they grow older, they can empathize with individuals with special needs. Because when there is inclusion, not only do children with special needs learn faster, but children without special learning needs can also benefit because they learn something hands-on about empathy, caring, being compassionate. Soft skills that most schools forget to instill because they are so engrossed with trying to teach hard skills with producing academic results. Okay. So with that, I'm not ending yet. I would like to share some slides on P-Bakat.
Maybe I'll quit you while you are setting up the
it's up.
Okay.
Share.
Okay.
Yeah, I think I found it.
All right. Okay. Because
sorry about that. I have wasting precious time. Huh?
No, it's okay. Yeah.
Okay. Can you hear me?
Yes. Yeah. Okay.
So a little bit about P-Bakat. I won't take more than 10 minutes. Huh? We are a non-profit NGO officially registered in 1990. Wow, 20 plus years, 30 years ago. Huh? Our objectives to create better public awareness and understanding regarding persons with special needs, to foster greater rapport among parents of children with special needs. And this is very important because sometimes parents can feel very lonely. Yeah? To support and provide assistance to children with special needs, as well as their parents, guardians, and families. Is everything okay? Can you hear me?
Yes, yes.
Oh, okay,
Yeah.
thank you. And to act as an advocacy to develop appropriate services for persons with special needs. We ran a lot of programs. It's a long story, but now we are only left with 2 programs, Special Care and Morning Glory. Special Care, I'd like to inform parents out there. We set it up because a lot of mothers with children who have very demanding special needs had to quit their jobs to look after their children full time because other centers were not. Daycares were not willing to accept their children. So set up to give my working mothers a chance to resume work, where we look after their children with special needs. Before the MCO, we had 11 children, but now we cut it down to 5. And then Morning Glory is I think it's about 4 years old, to train and empower our young adults through recycling activities and making of handicrafts. We started with 5 youths. Now we have 11 children, 11 young adults. And this is what Special Care is all about. We believe that our children, like your children out there with special needs, with the right support, they can go very far. Okay, like the humble Morning Glory. Okay, then we have OZAC. We were lucky in year 1919, P. Bakat was appointed by the state government to manage OZAC. Just like to inform everyone out there. If you are concerned about the development of your child, or you suspect your child has special needs, come to us. We provide early intervention services. Not only that, we have doctors to assess, and none other than Dr. Lim, whom you just listened to. He's one of the 2 doctors. They are helping out to assess children who are registered with OZAC. Assessment is free. T-shirts are provided free also. And then we have our range of physiotherapists, speech therapists, all the therapies, and of course occupational therapies, and doctors like Dr. Lim and Dr. Josephine Ng from NOMA. We never heard of all these specialists before, 23 plus years ago. And not only that, OZAC is also fully equipped with a lot of facilities like hydropool, Switzerland room, and so on, to help in the rehabilitation of children. And then you see we have all these therapies in place. Okay. We only charge 50 ringgit per child per month for a 1 session per week. For 1 session per week intervention at our center. And then if you are interested, or you know of children that may need early intervention, this is our contact. Okay, so with that, thank you very much, everybody.
Okay, thank you, Kichu, for that very heartwarming sharing of your personal journey. I'm sure, yeah, Dr. Ong also have a lot to share. And so perhaps I will, without much ado, I'll, turn over the floor to Dr. Ong.
Yeah, good afternoon. Thank you, Dr. Ling. Yeah, so first of all, I'm so happy to be here, to share a little bit information regarding my experience with my daughter who has dyslexia. Now, I started as a secondary school teacher, so I have educational background, but in maths and science. So during that time, in the 70s, 80s, so long time ago, Ayam Betelo. Now, nobody have heard about dyslexia. If we come across children who cannot learn as well as their friends, we use the word slow learner. Slow learner, pelajar lembam. So that is the term that we use way back 70s, 80s. And so my family, we have 3 children. It's a typical family. We have rules, like everybody, golden rules where children, you have to finish everything on your plate. 4:30, you have to leave the house, go outside and play, and like everybody else. And so my eldest girl, she's also like a typical learner, but she's quick and fast. Yeah, she's quick and fast academically. And my second girl, she is street smart. This girl is so super smart. When she was 3 years old, we had a verbal debate and I lost. And my sisters call her Lawyer Buruk because she has so much to say. Yeah, so much to say. For example, just to tell you the funny things or the witty things she said. She was just a few days past her 3rd birthday, and my eldest girl was 5 years old. So we were on the way to her tadika, my eldest girl tadika in Kota Kinabalu. I was teaching in KK. So that day I had to be late. The time is we have to pick at 12 o'clock, 12 noon. If you come later, you have to pay, extra money. So I told my eldest girl, hey, please tell Teacher Tan, Mommy has a meeting in school and she will be late. Please tell Teacher Tan, just a little bit late. I will be slightly late. So my eldest girl said, no, Mommy, I don't want to say. I'm so shy. And my second girl, just a few days past her 3rd birthday, Mommy, I will say. Yeah, I will tell Teacher Tan. So, okay, girl, very good. I will tell Teacher Tan, Mommy has a meeting, will be slightly late. I apologize, will be slightly late only to pick you all back. So upon arrival at the play school, the 2 girls went down and my second girl walked straight up to Teacher Tan. Teacher Tan, my mommy will be late. She will come at 13, 14, 15, 16. Because I told her I'm coming slightly after 12. And she said, my mommy will come at 13, 14, 15, 16. Now, that shows how her brain, like shooting off at the tangent. Then she was in primary 4. That was in 2004. Now, we didn't read the signals. My husband and I, we were so ignorant. We didn't check our children's school bag. We didn't check their homework. We thought everything was A-okay. So first it was, didn't want to go to school because of toothache. Then a few days later, didn't want to go to school because of stomach ache. And then somehow got some ache here and there. But one morning, she was crying and she said, Mommy, I didn't want to go to school today. Yeah. So why? You got some ache somewhere? She said, no, I didn't want to go to school because I didn't finish my homework. Huh? You didn't finish your homework? Why didn't you finish your homework? Because we never check our children's homework. I don't know how to do. Is it? So we were shocked. Suddenly, so it's like, okay, let me see your exercise book. What is it that you cannot do? So she gave us the exercise book, and when I opened, it's like my world went black. You know why? Because the teacher's red ink were more than her original pencil marks. Every page, there were red ink. The teacher was scrawling with red ink here and there. Oh, girl, you right from the first page. So we were so shocked. So that day itself, I went to the school to talk to the teacher. Yeah, that was in Sixiao. So we were talking to the teacher. Why is it like that? Your girl is slow. Your girl cannot read and write. She cannot spell. And she always missed the class. When it comes to Mandarin, English, and BM, she disappeared. Don't know where she went. And we found out that she went to the sports field. She wanted to train to be in the sports. And that was escapism. So it was like a real shocker for us that we have a brilliant girl, a brilliant child who is so witty with her words. And the teacher is telling us that she cannot, she's slow in her class. She cannot read and as well as her friends. So what is happening? So we took out all her books and checked. True enough. Yeah, true enough. She read that when we asked her to read certain things, it was very slow and she missed out the words and she couldn't spell. Yes, she couldn't spell. And so we tried to get an answer because I cannot we cannot accept that this girl is slow learner. At 5 years old, she repaired our video. And then she use her hands to create things for the house. How can she be a slow learner? So like Kwichu, so we are like denial, yeah? No, my girl cannot be a slow learner. There must be a certain answer. So we went around looking. And my husband had a friend, Gwendoline, who was a teacher in the Pendidikan Khas in SK Astana. So Gwen was saying, hey, maybe she has dyslexia. And I said, what animal is that? Never heard of dyslexia in my life. I've never heard of that term. And that was in 2004. What is dyslexia? You better go and read about dyslexia. Maybe your daughter has it. So I went reading, yeah, and say, oh, yeah, is this dyslexia? Then because I went to UK for my graduate education, so I have friends there. So I wrote to them. I said, my girl is like that. Where can I seek help? So they referred me to British Dyslexia Association, yeah, the BDA. And so I want to have her diagnosed. I want her to have her access exactly what is the source of the difficulties. And so they asked me to record her reading, asked me to take photo of her writing. And in the process of gathering data, I discovered that I shared symptoms with my daughter. When I was in primary school, I couldn't learn to read so well also. And when I was in primary 5, my nickname given to me by my English teacher was Miss Malaprop. And I didn't know the meaning of Miss Malaprop until I was in Form 2, because I did not know how to use the dictionary until I was in Form 1. And why couldn't I learn to use the dictionary? I couldn't get my A to Z right. I couldn't. A, B, C, D, I couldn't. So, yeah. So I said, hey, I shared the same symptoms with my daughter. And how did I cope when I was in primary school? I write and write and write. I can have a piece of paper. I will write with a pencil. Then I write with blue ink, green ink, and then red ink, then black ink on the same paper. I can write the one word 100 times, 200 times, just to commit it to my memory. So I memorized my way through primary school and early secondary. So when we knew that my daughter has dyslexia, I taught her how to memorize in 2004. I've never heard of phonics before. So I taught her how to memorize. I taught her, hey, you do like that. Yeah. Okay, you write 100 times. Then she said, Mommy, I don't prefer this word. She preferred to diam keng. You know diam keng? When she memorized also, and she will repeat 100 times to commit to memory. So that was how I helped her when she was in primary 4. And when I talk about dyslexia to my colleagues in UNIMAS, and many of them said, hey, you know, my nephew also like that, 12 years old, cannot read. And then my neighbors will say, yeah, you know, my neighbor, that child pun macam itu, 10 tahun tidak pandai baca. So then we begin to hear that there are more children like my daughter. And so in 2005, we started the pro tem committee of the Dyslexia Association of Sarawak, because we were thinking, yeah, if me as a teacher, my husband is also a teacher, we have not heard of dyslexia. What about the general public? What about the parents outside? Many of them would not know what dyslexia is. So in 2005, with a group of other parents, yeah, we started the pro tem committee, but we were not confident that Sarawak or Kuching needed us, because we already have PIBAKA, we have autism. Now, do they really need dyslexia or not? So what happened was 2005, we invited the Dyslexia Association of Wilayah Persekutuan. Now, they started their association in 1995. Look, in Sarawak, 2005, we are still talking about pro tem. And we still have people thinking that dyslexia is an animal in 2004. And they have started their association in 1995. So we invited the president and the secretary to come to Kuching, yeah, in 2006 to talk to us about what this thing called dyslexia. So we invited parents and teachers, and at the end of the 2 days, we asked the participants, the teachers, do you think or not that Kuching need Dyslexia Association? Everybody gave us a thumbs up. So 2007, Dyslexia Association was registered. We took 2 years to garner our courage and confidence, yes, to start the association. So yeah, thank you very much.
Okay, wow, really, thanks, Dr. Ong, for that very interesting, in a way, the experience of finding out that your daughter has dyslexia. I think from the sharing of both Kui Chu and Dr. Ong, I know for Kui Chu's, your daughter is having Down syndrome, so it is special learning needs in different ways, yeah, physical, health, as well as learning. So that is something that is detected at a young age, whereas for someone with dyslexia, like Dr. Ong's daughter, is, you only kind of show when she has something that you feel it is out of the ordinary, and sometimes maybe it is even harder to kind of come to term that, oh, how can she be slow learners, as said by the teacher. I think one thing that I want to bring out is that I think from the experience of both of you, it shows that there is a lack of understanding, of what are these learning disabilities, or learning difficulties, or we call special learning needs. There seems to be, a very general lack of knowledge. Like, for example, the teachers will not know that, oh, she has actually dyslexia. So that lack of understanding, lack of knowledge is often, also coupled with negative attitudes, yeah, for people who seems to look different, act different, behave differently, from us. So I don't know, in terms of this whole thing about, lacking, our general lack of resources, knowledge, and I would maybe call it like social barrier that are experienced by, by children with special learning needs. And also, I think how it impacts on the parents. Maybe would both of you like to share more on that aspect, in terms of the societal attitudes and social barrier that presented during, those years that you, help and support your children.
Yeah.
Okay.
Can I share another episode? So when my girl, now she's 28 years old, and she's a clinical psychologist. Yeah. So when she was in her secondary school, during the Hari Permufakatan, wow, the BM teacher saw me and my husband walking into the gate. Then, oh, Mak Kecing, mari sini. I want to tell you something. Wow, so yeah, surely something not so good already, though, from the body language. So I just quickly walk up to her. Yeah, cikgu, selamat petang, cikgu. Ada apa hal? Kecing, dia tidak boleh jadi budak cemerlang. Oh, apa hal, cikgu? Tak boleh jadi budak cemerlang. Dia tak boleh eja cemerlang. So just look at that. So I have to ask, apa kaitan mengeja cemerlang, boleh ke tidak eja cemerlang dengan menjadi budak cemerlang? Yeah. So anyway, this lack of awareness has to start with the teachers. Teachers have to get the correct information. Yeah, and the best place for teachers is in the Teacher Training Institute. That is where they have to learn about all the learning disability that Dr. Lim has talked about. But what is happening now is only teachers, only the pre-service teachers who are targeted for pendidikan khas will be introduced to learning disability. And that is wrong. It should be every teacher. Every teacher must be introduced, because you find children with ADHD, you find children with dyslexia, you will find children with high functioning autism in a mainstream class because their signs and symptoms are not visible. They will be in the midst of other children in mainstream classes. You will find them there. So every teacher has to know. And if the teachers know about it, yeah, then, you know, the parents, you know, then the next is to the parents. Maybe the teachers, they have PIBG or whatever. They will share the correct information. So now dyslexia is being thought of a slow learner or a lazy or stupid. So that is not correct information. It has to start with the pre-service training. And even in the way children with dyslexia are being supported. Yeah, what you see, children, because they have a different neural mechanism, the structure and function of children with dyslexia are different. They're different with the typical developing children. So if they are different, but the way the teacher teach is one size fits all. The way the teacher teach, B A ba, B a ba, ba ba bi bo bu, ma ma mi mo mu, is one method to all the children. Of course, yeah, children with a different brain architecture will not be able to learn and they will fall out. So these teachers need to know now, okay, if this child cannot learn my method, how can I look into the way they learn? And I will teach according to the way they learn.
Okay. Thank you, Dr. Ong. Preacher?
I am muted.
Okay.
Okay, can you hear me now? Huh? Yeah, actually, Dr. Lim and a few of us, I think we started something about educating, sharing, creating awareness for preschool children, for preschool teachers. 2 years ago, I think, training them. My part was communication skills. Dr. Ong, you were also in. You were the leader of the team. Sorry, yeah. So we have already started, Dr. Ong, trying to create awareness, and yeah, starting with teachers. It is also important to start with children. Do you know that in the West, what I heard in Australia, preschool children are taught sign language. Regularly developing preschool children with no special learning needs or physical or mental needs, they learn sign language to enable them to communicate with their peers who have special learning needs. Because not all can speak, not all can hear, but sign they can see. So to start them so young, not all teachers know the sign language. I know a little bit. I mean, some go the extra mile and try to learn, but how many of us bother to really communicate with our students or our children who don't know how to communicate using sign language? So that goes to show that we still have a long way to go. But I think, Dr. Ong, we have already started, and I hope that we have already managed to raise, even though it's just a little bit of awareness regarding how to identify children with special needs and how to address those special needs, and to realize that you cannot get autism, you cannot contact autism like the way you contact COVID by associating with a child who has autism or who has Down syndrome, or who behaves in a manner that is different from the regularly developing peer. So I think we have already started somewhere. Unfortunately, COVID came along, and it came to an abrupt stop. Otherwise, we would have shared with the whole of Sarawak, Dr. Ong. I'm sure you agree on that.
Yeah.
Maybe you'd like to elaborate more on what I was talking about. No?
Yeah, it is a
We
module.
even had a manual.
Yeah, it's a module with different units. Yeah. Yeah, and we went to Cebu and Bintulu,
Bintulu,
Miri. Yes, yes. We were supposed to
Moreover.
go to the other districts to
But
train
then-
their teachers. Yeah, but we couldn't do it. Now they're talking about doing a video recording.
Yeah, how to identify
Mm.
children who have a meltdown, how to respond when a child has a meltdown in your class. Not everybody knows how to respond to that. So we had Dr. Diana from Miri, also a psychologist, who shared on that. So eventually we will get there. But in the we compare what we have now with what we had 23 years ago, we are already moving ahead. When I look at facilities in OZAC, we are very actively involved also in managing OZAC. I told myself, if only these were around, these facilities, resources, everything, if only they were around 23 years ago, Ping Ping may have different learning outcomes. So we look back, we see what should be done, we try to help, because it's not easy traveling along the journey that we are undertaken. It's not easy. So I think parents these days are very much luckier. Yes. Like
Okay.
Dr. Ong, everybody knows what dyslexia is now. They know it's not an animal. The autism also was relatively unheard of 20 years ago. No, 25 years ago.
Okay, yeah.
But we
So-
don't want teachers to go around saying, hey, your child has some problem now, autistic for sure. We don't want them to start labeling our children. We have to be very careful about that.
Right. So yes, as I said earlier on, we have come, both of you have come a long way, but there is still a long road ahead, I'm sure. And I think, I would also, like to bring in this whole thing about inclusion, inclusiveness. I think, in terms of integration and acceptance of people with special learning needs, like as what Dr. Ong said, it's just that their way of learning work differently from others. I think there is still a long way to go in terms of generally society accept people who are different. So as you know, in our disability activism kind of words, is society that disable people. It's the kind of barriers that they that can be imposed by physical environment, by social environment, because of people's attitude and so on. So I think the way forward for us is really as you all were talking, and also earlier on, Dr. Lim and Dr. Chen was talking, I keep thinking, actually, we all, if we think of disability or special learning needs as a kind of continuum, we all have some disability in us.
Yes.
Yeah, we all have, yes, yeah. And also, I think it was very, how should I say, in a way, very inspiring for Dr. On to share that you realize that you have, also dyslexia only after when your daughter is found out to have dyslexia. So it's a kind of, in a way, kind of like a very liberating experience, to know that, oh, it's not because I'm, stupid, or I'm not hardworking enough, but because of the condition of this animal called dyslexia. So I think maybe this next 15 minutes, I would then like to open it out for more discussion and invite Dr. Lim and Dr. Cheng to also join us in the discussion to talk about, what could be the way forward for us, yeah, so that we can better support children and adults with special learning needs, yeah, or difficulties or disabilities. So could we maybe hear from Dr. Lim and Dr. Cheng as well? And if anybody would like to have any questions or comment, some of you who are parents out there, if you would like to give your comments or have questions, please put it in the chat as well. Okay, so could I hear maybe some thoughts from Dr. Lim and Dr. Cheng about what we have shared, in that last 40 minutes?
Yeah, maybe I'll talk first, yeah, Chen. Okay, yeah, it is certainly not easy. Like what Kwechu has said, we are still having a lot to do. And when I was trained in the United Kingdom, attached to one of the most kind of advanced center in the city of London. So what I learned is that there are many children with special education needs, be it autism, be it ADHD or whatsoever. They are actually learning and enjoying the mainstream education in the mainstream school. Now, what they have that we don't have here is the teacher assistant. That to me is going to be very helpful if we can have that as well. So people in the United Kingdom are fighting to get the diagnosis done. They are fighting, for all the diagnosis be met by the respective, professionals, because by then they can actually register, under the so-called EHCP, which is Educational Healthcare Plan, which will entitle the kid to a lump sum of money paid by the council, in such a way that the money is going to be paid into the child's account, which is kept by the school. And the money given to the child will be used to hire the teacher assistant, used to hire the speech language therapist, occupational therapist, and etc. As long as they find that the child needs certain therapies. So it is literally free of charge, in the perspective of the parents. But what do we have in Malaysia, being registered as OKU? I don't know, you know yourself, right? Certainly you won't get that much of money to use to hire a teacher assistant and so on, yeah? So that's why we are so much behind, just to echo what Kwechu has said. Now, what we can do here is probably we'll try as much as possible, even though your child has got special needs or special learning needs, try as much as possible to include them into the mainstream education. And this is what we are advocating for, a full inclusive, society. But I do agree, sometimes, some children might not be suitable, for example, those who are really having a lot of behavioral issues, who are really too slow in terms of intellectual ability. Now, those children are straightforward. They need some kinds of help. Now, I see special school, the advantage of studying in the so-called PPKI or special class is that the number of students is small. That is the main strength that I see that is available in the special class. The number of the children, the number of the students is small. So they have maximum previously 6, but now they increase to 8. Yeah, but that's relatively still very small as compared to a mainstream class, whereby a class you have 35, something like that. But majority of the children, so I would say, maybe unless they are really significant, the severity is really bad, then you might want to consider something like PPKI, because the number of students are small, particularly for those children with dyslexia. I think if we can identify the child with dyslexia early, and sending them for an appropriate teaching and coaching, especially in the Dyslexia Association Society, that all has a lot of a successful story, I'm sure. So we can easily kind of keep this child in the mainstream. Yeah, we can easily keep this child in the mainstream. And for the autism also, I have actually quite a lot of children with autism who are studying in the mainstream, and certainly those are of the higher function one. Now we try our best to push towards the very inclusive education or inclusive society. But now our problem is always, this with the school and education side. Yeah, not all schools are willing to accept them. And to some school, they are also, they have gone to an extent that the moment they know that your child has got OKU registration, they'll lock the door. Not only close the door, they lock the door, right? So it's very difficult. Now, how I see the thing can go in the future is that without the parents pushing factors, we as a doctor, we don't have much power. But if every one of you are so persistent to to keep your child in the mainstream, of course, reasonably, that I'm sure that our voice is going to be much stronger in pushing towards a more inclusive society. Yeah, and certainly I think that on our project on teaching the preschool teachers in kind of identifying those who are with the red flags of having the special needs, and to teach them how to help children with special needs to be extended to primary school if possible. Yeah, you were our leader, and I look forward to work with you again as the leader for another project. Yeah.
Okay, have to prepare the proposal. Dr. Lim, tolong prepare proposal.
Me, suffocating already. Yeah.
Okay.
Yeah, I think yeah. So truly, if you have a child with special needs, oftentimes I tell parents, and we have to prioritize the programs. Yeah. And many parents come to me say, no, totally, my child is flapping the hands all the time. What should I do? Then oftentimes I don't answer them directly. I said, well, do you have any other problem that you want to tell me? Yeah, so oftentimes they'll come up with a lot of problems that the child is facing. Now then I ask them, so what do you think? Which one is more important? Not being able to talk properly, having a lot of meltdown, or the hand flapping. All right, so oftentimes it can be quite a lot of problem in the child with special needs, but we have to prioritize the problem. And let's go for the most important one, because we are limited. Yeah, we don't have unlimited resources or energies and all those things. So just have to be realistic. Tackle the important problem first. And oftentimes we need to learn on how to accept them. It's not that we want them to change entirely. So oftentimes we need to change for themselves as well. Okay, so it will never be fair if you want them to change for you, isn't it? Yeah, so it has to be fair. If you change, they change, and everyone changes, so that we are living in a more conclusive environment. So yeah, and I think I have a question just now. How to identify if a child has got a developmental problem. Now, for your information, is that our nurses in the Klinik Kesihatan Ibu dan Anak in the whole state, or even in the whole country, are supposed to do the developmental screening for every child who are scheduled to attend the regular follow-ups in those clinics. Yeah, and so what I urge the parents to do is to be frank to them. Right, you've got to be honest to them. Yeah, so if a child can't do something, just be honest, because if you are not disclosing the true information, that potentially the child will be missed through this filtering system. Okay, so be frank. It's fine that the nurses raise the concern, but because why is it important? Because if really your child has got problem, it would be better to be identified earlier than late. Okay. Now, I know it is very difficult to accept this, and even though our two great and legendary ladies are also, kind of went through a phase of denial and very difficult to accept what they have, and Kiasu, culture in Kwichu, yeah. But I think we got to change our mindset, yeah. So tell the nurses what is correct, and in case there's any concern, we can raise the bell as early as possible. And as far as the interventions is concerned, I think the centers are mushrooming. right? So there are more and more centers available in Kuching area, okay? And OSAID is certainly one in the list, okay? So I think for that, I think Mr. Singh has actually preempted me to kind of prepare something so that our audience will know where to seek for help. And I have actually listed down a list of the centers that you probably can go, but it's not here yet. Probably I'll let Dr. Chen to talk something first, and then while I try to look for that slide. Is that okay, Dr. Chen? Yeah.
Yeah, okay. So
Yes,
Dr.
yes, yes.
Cheng,
Definitely.
yeah, okay.
So thank you for Dr. Lim and Dr. Ong, and also can I hold you, Madam Ng, is it?
With you.
Oh, with you. Okay. Thank you very much for all the sharing, and it's really inspiring for me as well to hear all the stories that's shared. And to respond to Dr. Lim, what happens at UK, I actually one of the one being paid to help the students when I was at UK to assist those students that need special needs. So I'm the one who received the payment. So really, there are a lot of things that we can do and we can do for our children with special needs. But here I want to stress one thing is for our parents who have children with special needs. There is no one standard what so-called good parents thing. There is no definite answer. There is no book teaching you. There is no standardized criteria for you or to consider as a good parent, or how are we going to support our parents. None of this. There is no perfect answer for that. And your children is special. Not only that need special needs, but individual differences. Every children is the same. If all autism is the same, then it's easy for us. But in reality, no, there's not. So every children is different, and every parent is different. And we learn to be their parents. Of course, we cannot, with children with special needs, we are the one who needs to enter their world, not they come to our world. I think it will be easier for us if we hold a mindset that instead of changing them, which is a bit hard, why not we change ourselves first? Changing ourselves, changing how we are dealing with them, changing how we perceive their situations, changing how we feel and our mindset. Hopefully, by bonus, our child can change. But that is not our initial or our priority. Our priority is ourselves first, as a parent, as a guardians, as a caretakers. So that is important. So I really admire parents who have children with special needs. There is no one perfect answer for that, and everyone is learning. Everyone is learning how to support our children. And it's your first time being a 12 years old mothers. Your first time being 11 years old boys fathers. We all are learning. So there is no perfect answer for that. But we develop and learn from each other's. I think that's all from me. Dr. Lim seems to find the slide now.
Yeah, I found it. Yes, I'll share. It's not a kind of a very lengthy list though. But I think it would be good as for your information. Some of you or many of you might have known or you know about these places. But I'm sure there are some still not quite aware about where they can go. Oh yeah, do you see that? Yeah. I don't know, color match wise, probably not so appropriate. But anyway, I just try to differentiate by using the white and black color. So Methodist Care Center, Pusat Integrasi Pintar, Kuching Autistic Association, One Stop Early Intervention Center, which is where Kwee Chu is kind of very active in, and Redwood Therapy and Learning Center, Milestone Early Intervention, Trinity Hope Dyslexia Association, Sarawak, Pusat Tuition, 20 dB. So this on the one on the right is the list of the centers whereby you can get speech therapy services, right? 20 DBs here in Kochi. Now they have a new name called Therapy 3.
Oh.
And e-speech care, Here Life, Hearing Care Center. You can actually get the contact number and as far as the location, the precise locations by just keying those names and by adding Kuching at the back and through the Google. Yeah, so now I think particularly about the speech language therapists, I think I have to highlight a little bit. Now it is probably the most demanding therapists in the town nowadays. Oftentimes they told me, they cannot cope because there's too many patients. I'm in a hospital. Yeah. And at your time, it was 1 for the whole state of Sarawak, right? I don't know, or at least 1 for the whole Kuching. But now we have, we used to have 4 in the Sarawak General Hospital. Now it's kind of downstream to 3. We are not only not getting better, we are in fact getting worse, from 4 to 3. So imagine, to serve the whole district of Kuching, they are not seeing only pediatric patients, bear in mind, they are seeing adult post-stroke, those who cannot swallow and all kinds of patients. And they are basically overwhelmed. And that's why, if you want to see them, the earliest or the shortest interval for the appointment or follow-up will be 6 months. To me, 6 months is a bit ridiculous, but it is beyond what they can actually change. So in terms of the therapies, other therapies like occupational therapies, physiotherapies and all those things, although we have a little bit more in number, but yeah, they are still certainly not enough. Yeah. And what I'm trying to say here is, although we are centers to go, we are occupational therapists and speech therapists in the hospital, in the Klinik Kesihatan Kerajaan, who are offering free services. But can I urge you, parents, you are the most important therapists to your child. Yeah. So whenever I see a child in the clinic, oftentimes at the end of the clinic sessions, I can more or less predict how much the child is going to improve and how much the child is not going to be improved by just looking at how the attitude the parents are and the resources that this family have, and as far as certainly the severity of the child in terms of neural disabilities. So please, parents, you are the most important therapists. Okay, now let's talk about the applied behavior analysis that that the church probably is quite familiar with. It's kind of a well studied and evidence-based interventions for children with autism, which is literally not available in Sarawak. Yeah, not so, but probably some way. Some people are providing this kind of ABA intervention, but it's not many. If you really want to go through those so-called evidence-based interventions to get a good outcome, you need to have more or less 30 hours in a week of the intervention. Now, where on earth you can get this kind of intervention by a clinical psychologist? It is literally impossible. So what does it mean? It means that parents, you are the only hope. Right, you are the only hope. Well, I think probably it's a bit too strong. You are the chance. You are the hope that to be the therapist for a child. If you are a good therapist, you are going to be a therapist for a child for more than 20 hours per week, certainly. Yeah, for sure. So what I'm trying to say is, I try to empower you as a parent. Yeah, you really need to get your hands dirty. You really need to get to the flow. You really need to communicate and really need to involve in all the interventions for your child. Therapists are there to help you. I'm there to help you as well, in terms of diagnosis or sometimes medications. But we rely a lot on you. Without your help, without your commitment, I think we cannot go too far.
I want to add on a little bit here. So other than the centers that Dr. Lim was listed, Borneo Medical Center, I'm locum at, which is I also available at Borneo Medical Center. So usually when parents come to me, children with special needs and parents come to me, I somehow, instead of like what Dr. Lim said, it's really impossible for me to provide 30 hours per week to actually to give interventions for your children. So I usually will train parents to really do MBA themselves at home. And this maybe, you know, like what Mr. Sim was saying after my session, is a lot of our parents was thinking how to manage the difficulties, the behaviors, or how to support our children by thinking ways. But analyzing, understanding your children is equally important. So by the first part, ABC, it is equally important. And Dr. Ong was sharing when she was gathering the data, she noticed herself was having dyslexia. So this is seeing how important it is, and also Madam Ong here also, like by analyzing, by observing the children, you know what is the function of behavior. Then we can minimize our effort, and we can use our efforts at the right spots. I think that is more important. So like Dr. Lim saying, parents, we have a lot of literature, we have a lot of clinical experience, have shows family therapy at home is most effective.
Yeah, that is certainly true. And Dr. Cheng, yeah, in fact, I presented a parent trainings kind of approach, one of the Asia Pacific international conference. And after that, I have a kind of quick discussions with people around the world, from New Zealand, from Australia, from UK. And none of them disagreed with me. And this is what they see as well in the so-called developed country. What are we? We are not even developed. If they need parents, if they cannot cope with a therapist and a client kind of a one-to-one interventions, I don't think we can. Yeah. So parents, please felt empowered. Yeah. Because you are very, very important for your kids. In fact, all the strategies that Dr. Chen has told you just now is not applicable. It's applicable not only to you, in fact, it's applicable to me as well, to any parents in this world who has got a child, who has got kids. The principle is still the same. The only thing is when it is typically developing, it's probably a little bit easier as compared to those who need special needs. And that's why the word special needs, because they need a little bit more support as compared to the rest. Yeah, so I think that's all I want to share.
Yeah, can I say something? Yeah,
Okay.
it is true. Yeah, as what Dr. Chen and Dr. Lim has said. Now, parents, you have to empower yourself. You have to support your children. Now, let's say your children cannot read. Yeah, cannot read, and is in a school, in a mainstream class. Now, the teachers have so many children to take care of. The one class, maybe 35, 40, even 45. So somehow your child with this special learning need might be sidelined. Yes, sidelined. So parents, if you take ownership, you learn about what is the best way to help your children to learn to read and write. You learn it, and you have the whole afternoon, after school, evening, night, weekends to teach your children. Yeah. So it is true. Yeah, parents are very, very important. So that is why Dyslexia Association, we do parental. Yeah, we do workshops for parents and teachers. Yeah, to empower them. Now, coming to inclusion, just now, Dr. Ling, you're talking about inclusion. Yes. Yeah, for mainstream, as much as possible, we want children with special needs to be in the mainstream class with typically developing children. But in Malaysia, we have what we call the partial inclusion program. Now, in 2003, Malaysia have a pilot project called the Dyslexia, National Dyslexia Program. It is on a pull-out basis, a withdrawal basis. Means when it comes to English, Malay, and Maths, the children with dyslexia are pulled out. They are pulled out for a specially trained teacher, yeah, in another room. Again, the number of children is very small, maybe 4 or 5, depending, but it's a small group intervention. And and the teachers are supposed to be specially trained and teach them. Yeah, but for any other subjects, they return to the mainstream class. So this is a partial inclusion. And it is good because these children get individualized and specialized attention in the pull-out classes. Now, when we started, yeah, we had, Sarawak has 3 schools, SK Laksamana, SK Kapit, Ulu Kapit, and SK Perbandaran Nombor 2 Sibu. We have 3 schools with this dyslexia program. But somehow now we only left with SK Laksamana. The other 2 schools have shut down the national dyslexia, while the prevalence of children with dyslexia are on the increase. By right, we need more schools with this dyslexia program. Instead, we have shut down 2 schools. So parents, raise your voice and tell the government we need more schools, yeah, with this dyslexia program, and specially trained teachers. Yeah, thank you.
Okay. Can I have Kwichu? Perhaps, you can have the last parting words to our audience out there, because we are actually 15 minutes over time, but it looks like, our conversation get even more exciting. But anyway, we have to, draw this webinar to a close. So can I have Kwichu to have kind of the last say? Yeah.
Okay. Thank you, Dr. Ling. Thank you. Can you hear me?
Can.
Like what Dr. Lim said, parents have to be involved. Even for OZEC, for any early intervention center, they are just there to tell you what to do. We only can spend 2 hours, Dr. Lim. The rest of the day, the other 24 hours, times 7 days a week, you are with your child or with a babysitter. So we cannot wait for miracles to happen within 2 hours in 1 week. No way. So early intervention, no matter how great the program, the OZEC program is very beautiful with all the attendance specialists and all. But if you don't take the effort to carry out, to continue what has been demonstrated to you for your child, no way your child is going to make much progress if you depend on the center, for any center for that matter. Schools also. I have also been guilty, like Dr. Ong, as an initial parent. I never checked the children's bag. But if you know, but that was because we assumed they didn't have any special learning needs. We really have to be involved. We cannot just be so laid back and let the schools admin take care of everything. It is not going to be easy. For me, it almost brought me down trying to balance everything, but you have to do it for your child. Okay, that's all I want to say here. The rest of you have been very great. Said everything I wanted to say already. Thank you very much. It's great learning from you. And we hope we can still continue like this. And Dr. Ong, take the cue from here, come up with the proposal. All together again. Or was it Dr. Lee was supposed to come with the proposal?
Yeah, Dr. Lee.
He's already up to here.
Yeah.
Okay.
The worst thing is I don't know how to swim. I'll
Never
sink
mind.
very fast.
Pedal. You don't need to swim. You just dog pedal only. You do the draft. I will edit the proposal.
Oh dear, I've got 2 proposals in my hand that is not completed yet.
All right. So thank you so much for the speaker. And then we still got one more questions from the Facebook that I wish to direct to Dr. Lim. So before we end this, I would like to ask Dr. Lim about this thing. One of our audience is asking about what are your view on apraxia, and then when can it be diagnosed? So can Dr. Lim get some explanation on this?
Oh, well, I don't know. And it's more either dyspraxia or apraxia.
Apraxia. Sorry, my pronunciation is not so.
Yeah,
clear.
it's kind of quite similar. I mean, people are interchangeably using these different terms. But I don't know if you're referring to the speech and language or you're referring to the motor bit. Yeah. And if it's a speech and language, I think it's more on a speech and language and therapy is a job. But if this is motor, I think sometimes we use the word childhood developmental coordination disorder, meaning the child is just kind of having problem in a fine motor skill, and they are not able to coordinate whatever their activities very well. So certainly if you have poor coordinations, then you might be having problem in learning as well, particularly in writing, coloring, and so on. But to me, I think, of course, if you see me, I can diagnose, but elsewhere, I don't know who else is keen to make this kind of diagnosis, or who else has good knowledge about this so-called apraxia or dyspraxia. But to me, I think, yeah, it's a very difficult question to me. How can get it diagnosed? If I say you come to me again, then the water level is much higher. I don't know. Basically, I don't have answer. But certainly, I can make the diagnosis, but this is certainly not a diagnosis that we commonly make, because oftentimes the so-called childhood coordination disorder or the so-called aberration does not come alone. Yeah, so it is associated with many other neurodevelopmental disorder. So it's probably a small part of the more kind of a bigger problem. Yeah, so in that case, probably the apraxia bit is probably not so important. But for example, a child with autism and apraxia, then autism would be a major concern or major problem that we need to really deal with. Yeah, so OKU, I couldn't remember if apraxia is included in the OKU registrations. I don't think so. Because the impact on the child's learning and so is not that huge. Yeah. And when I was a year in the UK, I've never seen a single diagnosis of childhood coordinations or apraxia be met. I think probably, to them is not too problematic. As for the ADHD and the rest of the neural disability, how can a child be registered? Is that the question?
I think it's more on like how should go apply for the OKUs.
All right. Now, yeah. So basically, any doctor with the title of DR can sign up the OKU, the BPP OKU form. Okay. For the registrations of OKU. At one point of time, our welfare department has actually come out with the rules that it must be signed by specialists. And it's when I receive overwhelming calls, my nurses are receiving overwhelming calls. It seems like the whole district of Kuching, I'm the only one who can sign. But luckily this statement has been reverted. And now every medical officers, no matter how junior or how senior you are, okay, even a retired, I think probably retired cannot, because you need to have a stamp, yeah. So any doctor in the clinical theater, in the GP's practice, in the private hospital can actually sign up the form for you if you really want. Okay. The only concern that I have is, signing out OKU is just piece of cake. I can sign it, I can complete the form in less than 1 minute. Yeah, it's just only a few parts for us to fill. But the problem is the diagnosis. So what is the diagnosis? I don't want your child to be labeled inappropriately and simply giving a name, simply giving a diagnosis. So yeah, I think a proper assessment is more important than signing out OKU, because by knowing what is the problem that your child is having, only then we can take care accordingly. Yeah. Now, if you want to get your child diagnosed, and again, I cannot say everyone comes to me. I'm not that great. There are many people out there who can do an equally good job, as me. Many family medicine specialists in the clinic kesihatan are able to do the diagnosis, make the diagnosis. And the scenario in the Kuching, in the district of Kuching, is nowadays that, if they have problem, if they think they cannot figure out what is the diagnosis, they think the problem is beyond what they can cope, then they refer to me. Yeah, so as long as they are happy, they are comfortable with the child's problem, with the diagnosis, they will just go ahead with whatever they're going to do. Only when they face problem, then they'll refer to me. I think that's kind of a fairer kind of approach. And in Cebu is a bit different. Again, it's a city of I don't know how to call it, but it's very different from Kuching. You have Agape Center, right? It is a place whereby you don't need even a proper referral. No, parents can actually walk in. I hope it's still true, but it has been quite a few years I left Agape Center. But I think it's still true that you can actually raise your own concern and you go to Agape Center and you know, look, I want my child to be assessed. As for the Bintulu and Miri, I'm so sorry, I'm not quite familiar with. Bintulu and Miri, but I do run the visiting clinic from time to time, but probably not during the COVID pandemic. But before that, I run visiting clinic in Bintulu. I went to Pipakat, Pipakat in the Bintulu, and I went to Sunflower Center in Miri, as well as and a hospital. So to run the visiting clinic. And other than me, Dr. To in Cebu is also running the visiting clinic there. So those are the places that you can probably kind of, if you want to see us, you know, you can go to those places. I would say, you know, don't wait for us. Yeah. There are many doctors in your locality can actually do a equally good job. Pediatricians, you know, many GPs as well.
Yeah, true. Like just now, Dr. Lim also got shared actually from the clinic Kanak-Kanak, the developmental milestone. That's the part that we should be, parents can be aware of and then starting to get some helps from that. That's the point. Yeah, all right. So thank you so much, Dr. Lim, for today's sharings, as well as Dr. Chang, Madam Kui Chu, and then Dr. Ong and Dr. Ling as well. So we are happy to say that we are coming to the end of this webinar. We are so sorry for dragging the time for at least, I think, 20 minutes. Yeah, but we are thank you for those who are staying with us. So this is a QR code, and then to claim your e-certificates for this webinar. So you can scan the QR codes or access to the links that we attach at the comment sections. All right, so next. Yeah, so for upcomings, by next week, we are having our programs on the same topics, but we are conducting in the Mandarin language. So we welcome parents who are more, who want to listen in information or talks in Chinese or Mandarin language can come to join this. And then we also have a workshop about the plays. So we welcome parents, teachers, come to join us to learn about how to implement play in your daily routine with your children. And then the last one, we also will have a child protections program that we have been conducted since our March program. So we also welcome teachers, get in touch with us, arrange with us so that we can approach your Tadika or your school, preschool to conduct what we say the child protections courses with your children. So that's it for today. Thank you so much for having with us. Thanks again. See you. Thank you.
Thank you.
Thank you so much.
Thank you, everybody. Thank
Bye.
you.
Thank you, Dr.
Take
Ong.
care.
Thank you, Dr. Lee.
Bye-bye.
Yes.
Thank you.